come up with this treatment plan?
Okay, so when Hala and I first met, she presented with being edentulous in the back bottom of each side of her jaw. And we talked about, there were some broken down teeth that were present, and we talked about getting Hala some back teeth to bite on. But we also noticed, and we discussed, that up in the top and the front of her mouth, she had a long-standing bridge that's had root canal treated teeth that where your facial profile should be.
Yeah.
And you could say a little bit about your dental history. Anybody who's going to be watching this is similar dental situations. So all of this is just, you and I, helping to give you something that's more stable, something that you're going to enjoy for the rest of your life, and something that's going to, not only look what you want to, but fix your bite problems. Yeah. So that when you're out in social situations, you don't have these things going on.
Because I can eat.
Yeah. You don't want to deal with that all the time. And then the reason we decided to, take care of everything now is because if we have to come back in a year, or 6 months, or 2 years, whatever it would be, to manage the back, it's going to be just a much better result of doing this all at one time, so we can open your bite up like we discussed because you're a little closed, and then get you where your teeth are flat across, so they're functioning normally. And then we could start doing things from the aesthetics, and because you're a very pretty woman, long narrow face, you can afford some length with your teeth, and right now the way they're a little short, they're a little squatty, they don't really fit your facial profile. In addition to everything else that's going on with them, and they've had a bunch of work done to them. They've had the root canals, and some of them are just breaking down, and there's problems, and they've done for a long time. They've done their job. And now it's time to go to something that's much more stable, so that you don't have to keep doing this. Nobody wants to keep doing this over and over. So that's what we're going to do, is we're going to solve it today, one time. Or trifurcate the tooth. A lot of So same thing, we're just going with our pilot drill first. Then we're going to go in with a 2-point, I have to look at myself, so many systems, 2.3 twist.
You do a lot of diagrammatic implants as well, correct?
All right, we're just going to increase the dimension again of the osteotomy site. For the collar of the implant, perfect. We're going to go a little wider in the posterior first. Going to prep this for full coverage now. Most likely will be part of the whole temporary.
Here's posterior, here's 12, here's 11, here's 5, here's 3.
Beautiful. So we're already lined up.
All have 40 to 45 at number 7. All minimally invasive, no flap, no suture. Nicole, picture. Vertical cancellous graft mix. And we still have one more of the fibrin membranes left. That if we need to do some more grafts, we may use this in a certain place. We might even use this on the facial number 7.
Perfect.
Okay.